I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and today I'm talking about Sculptra and actually showing injection of it. As I mentioned in the previous video, it's a milk sugar, it's polyallactic acid, and it's used as a series of treatments to stimulate the body's own system to build collagen, and that's what creates the volumizing effect. So I really like it because it's almost like being able to do a little bit of a fat transfer slowly and gradually over time. It takes about 3 to 6 months to see the volumizing effect, but it's a long duration product. It lasts about 25 months. So we've already treated the patient's upper third of their face, and now we're going to work on the mid-face zone. So I usually start from the top and work down. So we're going to work on the cheeks. She's actually nearing the end of her Sculptra treatment. She's looking great. She's got some nice cheekbones going on. We're going to do a little entry point from here, and I'm going to fan across a little bit. So a little poke on 3, okay? 1, 2, 3. There are distinct little fat compartments that are in the face, and that's what we're really trying to volumize over time. They have a tendency to deflate, and so starting around 30, we lose about between a teaspoon and a tablespoon of fat off of our face every single year, which is scary. So this is a means of sort of very naturally harnessing the body's own ability to build collagen and revolumize in a very subtle way. And do something that's longer lasting as well. Okay, so we're done with the cheek zone. You can see how that gives an immediate volumizing effect. This is mostly water and it's going to go away. I'm going to have you turn to your left a little bit more. And we're going to work on this sweep here as well. So a little poke back here, and we're going to do some fanning. I'm in the subcutaneous or the fat compartment. And I tell patients as I work back here that occasionally the numbing that's actually in the Sculptra that we incorporated can cause the upper eyelid just temporarily to be a little bit sleepy. And then often people lose a little bit of volume in this zone, so we're just going to put a little bit in this area. Here we're staying still in the subcutaneous compartment, but superficially. There's something called your parotid gland there, and we don't want to work deeply in this zone, but this is an area that has a tendency to lose volume over time. Perfect. And we'll keep on focusing on the patient's face. I'm going to treat with just a little bit more right in front of the jawline. So we've got this area that has a tendency to lose volume there. And if you pull the patient's ear apart, you can see sort of where that volume loss is. So I'm going to do a little poke. 1, 2, 3. And I'm reflexing to make sure that we're not near anything important. And that just elongates that jawline there. And then occasionally people need a little bit in the buccal cheek. You know, if I press, there's a little bit of volume loss there, so we'll feather just a little bit. This is sometimes starting to get into what's called the submalar zone. And that helps pick up the cheek. Good. And so that's really the mid-cheek. In the third video, we'll talk about the lower third of the face. If you want more information, you can see more about me, Dr. Melanie Palm at artofskinmd.com.